Hello, today we'll look at depression and unipolar depression. Why do I say unipolar? What does this mean actually? Uni stands for one, pole stands for a pole. We can have bipolar, that meaning two poles. But in this case we have unipolar, which means one pole. What does a pole mean? If you look at the magnet, it has one pole and a second pole. If you look at the Earth, it has a Nordic pole and a South pole. Depression also has, or not depression, but a psychiatric disease called bipolar disease means that we have two poles. In one end we have depression, in the other end we have manic behavior, meaning too happy, too active, too loud speaking guy, or too much. Okay, a guy who is too much, or a woman who is too much. That's manic behavior. And then depressed behavior is actually completely opposite. And therefore we call this bipolar disease, when a patient has both. When we're dealing with unipolar depression, we are dealing with simple depression. I don't mean simple by saying that depression is simple. I mean that it's only depression and not manic also. No manic behavior. But of course, if a patient has depression and then in 10 years from now gets a manic episode, then this patient is no longer a unipolar patient. He is now a bipolar patient, meaning a bipolar disease with both depression and manic behavior. So we have to recognize the symptoms now, and today we'll look at the symptoms. The synonym of unipolar major depression is actually major depressive disorder. This has been used previously. Nowadays we want to use unipolar and bipolar, and therefore I will try to stick to using unipolar. Major depressive disorder in the DSM-5 classification, this is just a classification system, it's called DSM-5, and we will see that unipolar depression, let's keep it simple now, call it always unipolar, have to have 5 symptoms. And 2 of them has to be depressed mood or loss of interest. Or not, I did not define it properly. Not 2 of them. Either we have to have a depressed mood or we have to have loss of interest. We don't have to have both of them, but we have to have either of these included in the 5 symptoms that we have. And it has to be for at least 2 weeks, not 1 day, 1 hour or so. It has to be a prolonged time, at least 2 weeks. Then we can call it depression. And we have to have these symptoms now together, at least 5, for 2 weeks. Then we can be sure that this is depression. Not really. We have to exclude substance abuse. First, we have to look, did this patient take cocaine, methamphetamine, amphetamine, or any cannabis, or did he do anything that is related to some drug that would stimulate his brain and then the patient would get depressed? If this is the case, then he has no depression. This is not a depression. This is just an effect after the drug itself. So please remove any substance abuse from the anamnesis. Exclude that. No grief, of course. If the patient has a mother who has died yesterday, you cannot call this depression. Of course, this normal person will be sad for more than 2 weeks. It will be sad for 2 years probably, but this is not depression. This is complicated grief. It's very, very, very sad thing that happened, and therefore he has a grief. Of course, grief can lead to depression, but that's a fine line differentiating between these two. No schizophrenia, so no schizophrenia in this patient, because then it can be symptoms of schizophrenia and subtypes of schizophrenia. So no schizophrenia, please rule that out. And there has never been a manic or hypomanic episode, because then it would be a bipolar disease, as we said. So no manic episodes. This woman have manic episodes. She's exploding of energy. She's exploding from inside herself. Okay. Which are the symptoms of unipolar major depression? Depressed mood, we have many of them. Let's go one by one. Depressed mood is simple to understand. Not grief, but it's depressed mood for more than 2 weeks. And the synonym of this, psychiatrists try to use dysphoria as a synonym. Dysphoria, as you see this guy, he's making a smile, but actually he is really depressed. So watch out. There exist people. I don't want to name some names, but I would likely to name some names. But you already know it. You see it in the media. You see it in the television. There exist really high celebrities that kill themselves. Okay? They kill themselves. And with no warning sign. And that's really dangerous. So this guy has a smile on his face, but he's empty inside. And then he kills himself the next day, and the family is shocked. But why? What? He was happy yesterday. What happened? No, he was not happy for more than, I don't know, 1 year, but you didn't recognize it. So therefore, I want to make this video because it's very important that you recognize the symptoms of depression, because otherwise this patient will kill himself and you will be shocked that your family member or friend killed himself. So please take this video very seriously and take all the symptoms seriously, and then watch out for them, okay? And help these people. Which are the symptoms? Because this is a disease. This is not a disease. This is not something that somebody is just whining and just kills himself. Yeah, just because he's a loser or he's weak. No, this is not weakness. This is not loser mentality. Depression is a real disease. Just as your heart disease or lung disease, depression is real. It's not sadness that led to a suicide. No, nobody commits a suicide just because of some light sadness or just loser mentality, or just because this girl is snobbish, a teenage girl that is just killing herself. No, depression is a real disease. And the dysphoria means now this depressed mood, and we'll look at the symptoms. Sadness. This is a simple one. You will see if a patient is sad. Hopelessness. This has to be asked a little bit if you want to find out if the patient is hopeless or not. Discouragement. This patient is discouraged. Anxiousness all day long, every day. Having no feelings. This is a good one. You have to watch for this one. Does the patient show feelings or no? Even if the patient shows feelings, do you feel the feelings? Because that's one thing to show feelings, but one is to feel the feelings, the real feelings. Annoyance. The patients are annoyed, frustrated, irritated, angry. Hostility. This is typical for men. They are angry, aggressive, hostile. Then we have the other one, loss of interest. So depressed mood, loss of interest, these are the two most important symptoms that you remember from depression. In DSM-5 classification, you have to have either of these two. Loss of interest. What does this mean? This girl has no interest in anything anymore. Just lays in bed, lays in the sofa, just do nothing, okay? This is called anhedonia. Psychiatrists would call this anhedonia. This is the synonym for it. That means we have no interest anymore in hobbies, in friends, or anything. So we have no interest in going to parties. We have no interest in doing any hobbies anymore. We have no interest in being with friends and having a nice dinner with them and hanging out. We have no interest in having any sex anymore. The purpose of our life is completely gone. Now, change in appetite. Here comes the other symptoms that are important, but they are not so common. But actually, these are very, very common. But I'm just saying the depressed mood and loss of interest is the two most crucial thing that you remember. Change in appetite. This can be either too much eating or too less of eating. Okay, so it's a forceful eating. You have to force yourself, or crave for eating. You just eat. Okay. Sleep disturbance. This can be something called insomnia, or it can be hypersomnia. The same as with eating, it can be too less of sleeping or too much of sleeping. Okay? Hypersomnia just means that you sleep more than normally. For example, instead of sleeping 8 hours, you sleep 10 hours or 11 hours. And during the day, you also want to sleep. That's hypersomnia. Insomnia just means that you sleep too few hours, let's say 4 hours, 5 hours a night. Initially, initial insomnia can be that you cannot sleep. When you go to bed, you cannot really sleep. But when we are talking about middle insomnia, instead here we're talking about that you can go to bed and sleep, but then in the middle of the night you wake up, and then you have problems. Or terminal sleep, that you wake up too early. That's terminal one. So initial, middle, or terminal insomnia. Difficulty getting to sleep initially, or then waking up in the night, in the middle part, and it's difficult to return to sleep. And the terminal insomnia, meaning that you wake up earlier than usual and then you remain awake. Fatigue, simple one. You feel tired all the day. So you have anergia, lack of energy. This is a psychiatric term, anergia. This girl is completely exhausted. So what do we have? We have tiredness, we have exhaustion, listless, sleepiness during the day, limb heaviness, difficulty initiating and completing your activities that you should. Okay? Cognitive dysfunction. Your brain does not function as it used to be. So for example, what do you have problems with? You have problems with thinking. Your problem is concentrating. The decisions that you make are not so good anymore. You have problem with making a decision at all. You're distracted. Your memory is not as good as it used to be. Attention span is really getting worse. The concept shifting, meaning that you are fixated in one concept and you cannot shift to another concept. Planning, your planning is not good. Your problem solving is not good. Reasoning, you don't know the logical steps of reasoning anymore. Impulsivity, you're too impulsive. And information processing speed, you're sitting in your class and you don't process this information as quickly as your friends are. You're slower than you used to be. Verbal fluency, you speak slower, or you speak not so fluently anymore. You make a lot of mistakes. Social cognition, your social interaction is getting worse. Your friend starts to feel something about you, that something is wrong here. Psychomotor agitation, you're agitated. You are always repetitive in your muscle movements, like tap, 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 tap. You're sitting there with your foot and you are making a hand fidgeting. Your inner tension is so huge in your brain. You're fidgeting. You see, you're fidgeting with your hands. You're doing this tapping. You're psychomotor agitated. Psychomotor retardation, on the other hand, is the opposite. You're too slow. You have slow body movements. You're thinking too slowly. The same as the processing information. You're thinking too slowly. Your memory is bad. You're slow and quiet when you speak. Okay? Then we have feelings of worthlessness. You think that everybody hates you, that you are worthless. You think that you should be critical on yourself. You have guilt. You're critical. I'm so bad, and then you hit yourself. Okay? Suicidal ideation. You think about suicide. You have it in your mind. And this can be actually passive, which means that you think about it. You don't do anything about it, but you think about it. Or active, you actually do it. Passive or active. Passive meaning you have thoughts of life not being worth anymore. When you ask a patient, how is life? Then he answers, what is life? Why do we even live here? Well, what's the purpose at all? And then you start these questions. This is a passive suicidal ideation. Passive suicidal ideation. Active suicidal, then you're planning it. This is very, very in the end. Okay, here you actually set the date. Next week I will do it. Today I will write a letter to all my family members and friends and tell them that I'm sorry, but I cannot live anymore. Suicidal behavior, it's actually cry for help. A girl cries for help. She takes a lot of medication, puts puts it in her mouth. She knows that she will not die, but she wants attention. She wants this feeling of being worth, being alive. All the doctors and friends and family members will then be there for her because they are not there for her at the moment and cry for help. If she do something about it, they will think about her more and speak with her more, cry for help. So psychotic features, these are very dangerous ones, because if we have a depression and then you have psychotic features also, meaning hallucinations, for example, auditory hallucinations, which commands you to commit suicide, then it's very, very, very dangerous. And usually this can be seen in schizophrenia. But there are some depressed patients that can also have some psychotic features, and psychotic features that have auditory hallucinations telling this patient to kill himself or herself. It's really dangerous because the patient will actually listen sometimes to these voices. And the worst scenario would be if the voices are telling this patient to kill somebody else, because then this patient will be a killer. Okay, what does non-suicidal self-injury mean? That means that the patient harms themselves, expecting that this will now relieve all the depressive pain. So this girl now thinks that if she harms herself, then this tension will be relieved and she will feel better. Actually, it will for a couple of minutes, or I don't know how long, but it will be a little bit of relief. But that's only short term. And then she will have a lot of scars on herself. Now the family members will give her support. She will feel a little bit better. Okay? Dwelling on a single theme. I've drawn this continuous thing. You're dwelling on one thing. You're depressed. You're just dwelling. And this is called ruminative thinking. Ruminative thinking. This is what the psychiatrist is telling. Ruminative thinking. Dwelling on one thing. The symptoms of depression typical for females of all this that we mentioned are insomnia, so not sleeping good, loss of appetite, low energy, headaches, myalgias, meaning pain in your muscles, gastrointestinal problems, stress, all the stress, crying easily, so these girls are crying easily, and interpersonal difficulties. This is typical for females. Typical for males are anger, or aggression, or losing control, threatening someone, substance abuse, and risk-taking behavior. For example, these patients drive recklessly. Half of all depressed patients have these symptoms. Half of them. This is very important. Sadness, irritability, anxiousness, loss of interest, impaired concentration, worthlessness, guilt, hopelessness, and fatigue. So as you see, the same symptoms, I just grouped them into the most important ones here. The symptoms usually found in more severe depression, that is really, really severe, are sleep disturbances, change in appetite, somatic complaints, meaning problems with your body, your organs, headaches, pain in your leg or knee or whatever, somatic complaints, psychomotor agitation, this tap, tap, tap thing. These are severe depressive signs. Of course, suicidal ideation and so on are also included, but when you're dealing with these simple symptoms, these are the ones. The most frequently found compared to minor depression are suicidal ideation and psychomotor slowing. The difference between major and minor is just the degree of depression, how severe it is. Minor depression is not so severe. Major depression is very, very severe. So suicidal ideation and psychomotor slowing is more commonly in major depression. Okay, suicidal ideation and psychomotor slowing. You're too slow, as we said. The subtypes now of depressive disorders, you can group them into different, because we have depression, but there exist patients who are more toward a specific subtype. There are interesting characteristics of patients. For example, anxiety patients. They can be patients who are have anxiety, worrying a lot. They have this thinking rumination, so thinking about one thing, health anxieties, so hypochondrias, panic attacks. They have hand wringing, this hand wringing thing. These are anxious depression. And then we have other patients who have other things. And 50% have anxious, and the other things that we will list now are the other 50. So I would say anxious depression is the most common one. That's the most important one to remember, these things that we said. Anxious depression being 50%. Then we have atypical one. Atypical meaning feeling better in positive events. So you have a positive party and everything, and the patient is feeling good. And then he goes home and he's sad. This is feeling better in positive events. This is an atypical thing. Hypersomnia meaning sleeping a lot. Hyperphagia meaning eating a lot. Heavy limbs meaning feeling heavy limbs all the day. Interpersonal rejection sensitivity, very sensitive to anybody rejecting these persons. Earlier age of onset, so teenagers. Family history of depression, so ask if your mother or father had it, or a grandfather, and so on. Substance abuse, these are atypical ones, so the alcoholic patients, or patients are depressed and then they turn to alcohol for assurance. They feel better. Suicide attempts, these are atypical depression, actually, thank God, actually. So atypical is suicide, that means that it's not so common. So the majority of depressed patients are not doing a suicide, okay? Personality disorders, different personality disorders can be seen in atypical depression, and anxiety is also in atypical depression, or very commonly. Catatonic are actually a very interesting group of depression. We have hypokinesis, meaning we have slow movements. Akinesis, meaning no movements at all. This picture just show that this girl is not moving. Of course, catatonic akinesis patient will not look like this girl, but I could not find a good picture showing that I can use here, because most of the pictures from psychiatric diseases are actually not for sale, or you cannot buy them so easily. So akinesis, just remember that these patients are very hardly moving, okay? Akinesis. Mutism, they don't speak so much. Stupor, they are almost unconscious in a state. They can be almost unconscious. But as we said, all the symptoms does not have to be included. There can be a different, for example, 3 of these symptoms can be there and the others are not. So you have to select based on the symptoms that the patient has. So somebody maybe have stupor, or somebody maybe are mutism or hypokinesis, and so on. I just list all of them one by one. So this is not the list that you should think that you should have all of these. Okay, negativism, always negative. That doesn't matter what you say to these persons, they are negative. Waxy flexibility. This is an interesting one. This picture just showed us that if you put this doll here in this position, it will stay like that. And if you put a catatonic patient in a position, let's say I put the arm like this, then this arm will stay there. It's a waxy flexibility. It's like a wax, like a candle. It doesn't matter how you put the body, it just stays like that. Okay, that's a typical catatonic waxy flexibility. Posturing, there's the same thing, almost like waxy flexibility, that they are having this very confusing, interesting, bizarre postures. They can like stand like this, or stand very strangely, okay? Very different posturing. And have excessive purposeless muscle activity, as we said, tap, 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 agitated, staring. This is very usual for this catatonic behavior. They are staring. Echolalia, meaning that they repeat the words you say. So you say something and then they just repeat it. No sense, but they just do it, like this parrot. Then you have echopraxia. They mimic what you do. Of course, these two, this father and son, is not doing echopraxia in that sense. I'm just showing this picture because I cannot find other better pictures showing that this son is doing exactly as his father is doing. That's echopraxia. You're mimicking what other person is doing. Okay? Melancholic, as the name suggests, this word suggests melancholic. It means unresponsive to improved circumstances. Doesn't matter. I get some money, for example, in this case, in this picture, but I don't get happy. Unresponsive. You are completely melancholic. Anhedonia, no feelings, again, to friends, no feelings for hobbies, as we said, no feelings at all. Psychomotor agitation or retardation, we have talked about this, tapping or very slow. Cognitive impairment, we said all the memory problems, processing power, and so on. Interrupted sleep, we said insomnia or hypersomnia. Loss of appetite, which means we have hyperphagia, for example, or forceful eating, and diurnal variation. That meaning, for example, you're always sad in the evening. Then in the morning you're good and sad in the evening. So melancholia more common in severely ill patients and in psychotic patients. So severely ill patients and psychotic patients have usually melancholia. Okay? And the treatment needed for melancholia is tricyclic antidepressants and electroconvulsive therapy. I will not deal with treatment in this presentation, but I just wanted to highlight here that melancholia have a different treatment. Tricyclic antidepressant, electroconvulsive therapy. Electroconvulsive therapy, I think you have seen this in some movies. It looks very scary and so on. It is used also nowadays. We usually use a medication nowadays, but electroconvulsive therapy can be used by severe depression or severe diseases. And in melancholia, it has been shown that it can actually make the patient feel better. Okay? So these are the treatments. Mixed features. We have these subtypes, and then we have mixed features, which means that we can have, for example, this depression with manic or hypomanic symptoms. And now you will get confused because, as we said, this would be almost a definition of bipolar disease, because we said that unipolar major depression with hypomanic or manic would be bipolar, but not in this case. It's not so severe. It is, for example, 3 hypomanic symptoms or 3 manic symptoms with this major depression, and not for a long period of time. Okay, it is not a characteristic of this patient that he has hypomanic or manic symptoms. If you look at a classification of bipolar, you will see that you need more than just these 3 symptoms to have a bipolar disease. It's not enough to just have 3 symptoms of hypomanic. And I want to just tell you I will not deal with mania or hypomania in this presentation, but I want to tell you some of the characteristics. So what am I talking about at all? Hypomania and mania are very similar, okay? But it's less severe. So hypomania, a patient would say, I have a very good self-esteem and I'm talking quickly and I'm feeling good. You know, you're a little bit above the normal persons, normal people, okay? You think that you're a little bit better. And as we maybe talked about previously, ambition and hypomania is very close, but they are not the same thing. For example, a hypomanic person could say that I'm really good looking, I'm so strong, and so on. He could go on and on about himself. Of course, an ambitious person could also tell some things that are related to that, but it would not be so severe as hypomania. Mania, it is the third step. It's even worse. This person thinks that he is God. He thinks that he is king of this world, and you can have no correlation between them. So, for example, when a boxing champion, I will not say his name, is saying that he's the greatest on this planet, I mean, he's not manic because he have already showed that he's good enough. When we're dealing with manic patients, that would be a guy who doesn't train, do nothing at home, And then he says that he's the boxing champ of the world. That's a delusion. That's a really grandiose delusion that he is the boxing champ of the world, which have no substance. There's no truth in it. But if you have ambition, on the other hand, let's say Elon Musk is saying that he will go to Mars, then it could be discussed that is this a grandiose delusion? No, it is not. He's actually working on this. He's actually showing that he has not millions, but he has already achieved billions of dollars. So it is not a delusion, it's an ambition. So please, people, when you look at this presentation, you will actually feel that you have a lot of common things with all that I'm saying, but that's normal. You have a normal level of all the things that I'm saying. If I'm saying that the sadness, of course you are sad sometimes. Of course you're angry or anxious and all the things. Of course you have self-esteem sometimes. You look in your mirror and sometimes you feel good about yourself. But that doesn't mean that you're hypomanic, okay? So, hypomanic symptoms, let's see them. Inflated self-esteem, but no delusion and grandiosity. That's hypomanic. I will list all the things that are hypomanic here, because manic is the opposite. So for example, manic patients have delusional grandiosity. As I said, he thinks he is God. Hypomanic don't think he's God. He just thinks that he is really, really good. He has an inflated self-esteem, and it's not ambitious. He's more than ambitious. Flight of ideas, but more organized. So hypomanic patients have a flight of ideas. The ideas are just coming from here and there, and you can say that this is very good. Very good if you want to be creative. You have a lot of ideas. That's good. But for normal people, that is good. But for hypomanic patients, these ideas are completely coming from outside like a storm. Okay? And for manic patients, it is also completely disorganized. In hypomanic, at least, it is the thoughts are at least some structure. There is some organization structure here. And actually, hypomanic patients could actually then be successful. But manic patients would be completely disorganized, and I would say they would not be successful because it's completely bullshit what they are saying. Thinking quick and creative compared to racing thoughts. So let's go one by one. So inflated self-esteem, this cat thinks he's a lion. Flight of ideas, but more organized. Hypomanic, you organize the thoughts at least in the box. Thinking quick and creative compared to racing thoughts that are disconnected. Yeah, in manic, as we said, they're completely disconnected. The thoughts are so quick and so racing, but they are disconnected. In hypomanic, at least they are connected. They are racing thoughts, and the thinking is quick and the thinking is creative, but it's hypomanic, and actually it can be productive. Loud and rapid speech, but easier to interrupt. In a manic patient is very hard to interrupt. Whatever you try to interrupt him, it's like impossible. Hypomanic, it's easy. Okay, it's easier, not easy, it's easier. Improved social functioning compared to impaired social functioning. This is what I'm talking about. Hypomanic could actually be an improved social function, so an improved function in this world. Okay, manic or completely delusional. Mild risk-taking behavior. So hypomanic is mild, manic is severe risk. Okay, this is mild. Manic would, I don't know, jump on this car or something. No psychotic symptoms. In hypomanic, there's no psychotic symptoms. In manic, there are. Almost never requires hospitalization. Hypomanic are usually not in the hospital. These are producing persons. They are patients, but they are producing. Almost, as we said, it's a fine line between ambitious and hypomanic. So they don't require hospitalization. Manic patients requires hospitalization. So how common is major depression with mixed features? 30%. So this is the dangerous in diagnosis here. Do we have a bipolar disease, or do we have a depression with a mixed feature? Yeah, you have to look at the classifications and then you have to decide. 30% of patients with depression will have mixed features. So it's a huge group, actually. Peripartum, this means that the patient have depression while they are pregnant, okay? And not just while, also within 4 weeks of childbirth. So after the childbirth, okay? So, psychotic patients can be differentiated between depression, but there exists depression with a subtype of psychotic features. And psychotic features being delusions, being hallucinations, being thought that are disorganized, being agitation, and aggressive. This is psychotic depression. Seasonal is every winter comes and I'm getting sad, I'm feeling bad. That's a seasonal. It's called a seasonal affective disorder, recurrent episode of depression occurring at a specific time of the year. Okay, so that was a lot of symptoms. Let's look at them really quick. This will be really quick. I have already really explained everything, so now we will rush through this presentation. Synonym is major depressive disorder. We have classification for the diagnosis of depression is 5 symptoms. One have to be depressed mood or loss of interest, and it has to be at least 2 weeks. Okay? No, it has to be no substance abuse, so no substance abuse, no grief, no schizophrenia, and there has never been a manic or hypomanic episode, of course, except in the mixed type, as we said. The symptoms being depressed mood. This is synonym is dysphoria, and dysphoria have sadness as a symptom, hopelessness, discouragement, anxiousness, having no feelings, annoyance, frustration, irritability, anger, and hostility. We have loss of interest, very, very important symptom. So loss of interest, and this is called anhedonia. Anhedonia meaning loss of interest in events, partying, loss of interest in hobbies, with friends, and no sexual interest at all. Change in appetite, eating too much or eating too less, forceful eating or crave for eating. This is the question. This is typical symptoms. Sleep disturbances, having insomnia, as we call it, or hypersomnia. Insomnia, we can divide into many types. Hypersomnia is just sleeping during the whole day or during 12 hours a day. Insomnia, as we said, initial insomnia, meaning you cannot get into sleep. Middle, meaning you wake up in the night. Terminal, meaning you wake up too early and then you cannot sleep back again. So difficulty getting into sleep, difficulty in the night to sustain the sleep, and then terminal, waking up earlier and then remaining awake. Fatigue, you have lack of energy, calling anergia. Anergia meaning you are tired, you're exhausted, you're listless, your sleepiness during the day, limb heaviness, difficulty initiating and completing activities. Cognitive dysfunction, we have many things here. We have thinking problems, we have concentrating problems, decision making, distractions, memory problems, attention deficit, concept shifting is hard, planning is hard, problem solving is hard, reasoning is no reason behind your thinking, impulsivity. Then you have information processing speed is very slow, verbal fluency and social cognition is really impaired. Then we have psychomotor agitation. Here we have a repetitive muscle movements. We have inner tension in your body. You have hand fidgeting, and the opposite being retardation, psychomotor retardation, meaning you're too slow. Okay, so you have slow body movements, you have slow thinking, slow and quiet speech. Then we have feelings of worthlessness, you have feelings of excessive guilt, you have suicidal ideation, either passive or active, doing it also, not just thinking about it. So passive being your thoughts of life is not worth anymore. You're actively planning suicide, that's the active part, that's the more difficult part. You need to really quickly treat this because we have cry for help also. These patients just needs to have some help because otherwise they will commit suicide often, and actually suicide will never be accomplished because they just want help. And the dangerous symptoms of depressive patients are those who have psychotic features also. Non-suicidal self-injury mean that they harm themselves expecting that this will relieve their depressive symptoms. And this is a very common thing, that non-suicidal self-injury. This is the same as we said, cry for help almost. But in this case, it's more more about their own feelings, that they feel better when they do it. Dwelling on a single theme, continuously dwelling, this is called ruminative thinking. And depression, typical for females, being insomnia, being a loss of appetite, low energy, headaches, myalgias, gastrointestinal problems, stress, crying easily, and interpersonal difficulties. For males, it's more anger, it's more aggression, losing control, threatening someone, substance abuse, and risk-taking behavior, for example, reckless driving. Half of depressed patients usually have sadness, irritability, anxiousness, loss of interest, impaired concentration, worthlessness, guilt, and hopelessness, and fatigue as a symptom. Half of patients of depression have this. Then severe depression is when you have sleep disturbances, or you have change in appetite, or somatic complaints, or psychomotor agitation, and suicidal ideation, which I didn't include in this list, but I would include it. So major depression compared to minor is that we have suicidal ideation in major one and psychomotor slowing in a major one. Subtypes of depressive disorders are anxiety subtype. Anxiety depression can be, for example, when you're worrying a lot, you have ruminative thinking, so one fixed idea. We have health anxieties, so hypochondrias, panic attacks, and hand wringing. Then we have that 50% are usually having anxious depression, so it's, I would say, one of the most common ones then. Atypical ones are, for example, they feel better when they have positive events, hypersomnia, they sleep a lot, they eat a lot, hyperphagia, having heavy limbs, interpersonal rejection sensitive, so they are sensitive to any rejection, earlier age of onset, so in teenagers, family history of depression is there, a substance abuse, suicidal attempts, and personality disorders and anxiety. These are atypical depression. So you look at this list and you see this is the atypical one, not the typical one, okay? Catatonic, here we have, for example, hypokinesis, moving slowly, or akinesis, not moving at all, mutism, not speaking, stupor, almost a near unconsciousness state, negativism, meaning you're very negative, waxy flexibility, that you are having a posture that when you move an arm, it stays like that, posturing, very strange postures, excessive purposeless muscle activity, staring, these patients are staring, echolalia, you're repeating the same words that the patient is, somebody is telling, they are repeating the words, echopraxia, you're doing the mimicking the motions that you do. Melancholic, this is unresponsive to improved circumstances. They have anhedonia, we said lack of interest, psychomotor agitation, retardation, cognitive impairment in melancholia, interrupted sleep, loss of appetite, and diurnal variation. So, for example, melancholic patients are more sad in the evening, for example. Then it is more common in severely ill patients and in psychotic patients. So melancholia is more common in these ones. And the treatment, I will not deal with this so much here, but I just wanted to highlight the electroconvulsive therapy. Many people are very afraid of this because they have seen many movies, and it looks so horrible, and people think it's so stigmatized. But for melancholia, it has been shown that it's useful. Mixed features, this just means that we have around 3 symptoms of manic or hypomanic also, and please don't confuse this with bipolar disease. Look at the classification of bipolar and you will see that it's different. So it's not enough to have just 3 symptoms of mania. Hypomania is a little bit less severe than mania. As we talked about, this right guy thinks that he's king, and this hypomanic girl just thinks that she's beautiful, which is not true in this case. For many people, she would be considered overweight, and not many people like overweight people. I don't want to make political statement here. I know that we should accept everybody, but most of the people like when people show a good fitness level, and that's more attractive. And this girl thinks that she's very attractive, and she's a little bit hypomanic. And these patients have inflated self-esteem, but no delusional grandiosity, means they are not delusional about it. They just have inflated self-esteem. They have flight of ideas, but they are more organized. They are thinking quick and creative, but it is connected in hypomanic patients. They're not disconnected. they are very loud and rapid in both of them, but it's easier to interrupt manic patients. They have improved social functioning in hypomanic patients, whereas in manic patients, they don't really function socially. There's mild risk-taking in hypomanic patients, where it's very, very risk-taking in manic patients. No psychotic symptoms in hypomanic, and almost never requires any hospitalizations. And the mixed features is actually very common, 30%. 30%. Peripartum means that we have depression in pregnancy and usually within 4 weeks of childbirth. Okay, that's peripartum. Psychotic means that you have psychotic features of what? Of delusions, you have hallucinations, you have thought disorganizations, agitation, and aggression. Okay, these are psychotic features. Seasonal meaning that you have a seasonal affective disorder that comes, for example, in the winter always, at a characteristic time of the year. And that was it. Thank you. This was a very, very long presentation. I know, very, very boring maybe with all these symptoms, but I want you to remember that depression is a very, very important topic. And if you want to master it, please look at this video once again. And please use this YouTube feature that you have, that you take the speed of 1.5, for example. Then you can understand what I'm saying, but it's going a little bit quicker. And always I'm making these repetitions so that you can remember the presentation instead of just moving on and don't getting anything about it. And we have seen that I have done studies myself, and a lot of psychologists have done studies, that when you're doing passive memorization like we are doing now, meaning you are sitting there and you are listening and you are doing nothing, that's a passive memorization, then you will not remember so much. But if I include a lot of pictures, which I did, if I include my auditory thing, which I did, which I include a lot of text that complements it with a logical sequence, then it will improve your understanding, it will improve your memorization. And if I add a repetition into this, so I'm not saying this material only once, I'm telling it for at least 2 times. I don't want to tell it 3 times because then this video would be too long. But if I do it at least a second time, a quick review, then you will certainly remember at least 70-80% of this presentation. And that's my goal. I want you to recognize depression, and I want you to help your family and friends to deal with this issue, because it's very, very important that we are happy. Okay, so have a happy evening or happy day, and have a nice day. Bye-bye.